Wendy, can you comment on the medications that you're taking for the chronic pancreatitis?
I was taking a bunch of different type of pain medications. When one didn't work, they would try another one, and then when that didn't work, I went on another pain medication. I also was taking an anti-nausea medication because I was having a lot of nausea, which was a miracle drug. And again, the pancreatic enzyme. So I was on the narcotics, enzymes, and an anti-nausea medication when I was having the pancreatitis.
And how easy or how difficult did you find it for you personally, to follow this regimen?
Taking the anti-nausea medications and the enzymes wasn't as difficult as taking the narcotics, because you always are labeled when you take a narcotic. Mm-hmm. And for me, it was difficult to even be prescribed a narcotic because I didn't want to be labeled as having an addiction. And I always thought that you would get addicted if you're on it long term. So for me, it was very difficult to take the narcotics on a regular basis. I would take it when I needed it, but then the doctors would be like, well, you need it all the time because when you have the pain, it's too late. You need it to help control your pain. So it took a long time for that to sink in. So I felt like I was taking it a lot. So.
Yeah, Tina, please.
I had a lot that I used to take when I first got sick. Now, it's just habit. I get up in the morning, I know what I need to take, but I also take, medication for other things, depression, migraines, got depression from having the pancreatitis, so, but now they're not as many, so I don't need all the pill cases.
No, that's very good, but it's very important to stress that it's extremely important to take these medications. Yes. To make sure that that you are kept at a low, good, functional baseline. So that's very good.
I can tell, like, if I do miss my meds, and I can feel. I'm like, oh, I didn't take my medication this morning. I can definitely tell.
And I also tell the patients with chronic pancreatitis, and I don't know what your experience was, that if you forget to take a pancreatic enzymes here and there, even though it's not the end of the world, be prepared, depending on what you ate, to have some symptoms, because not having enough made by your pancreas and then taking something that is very fatty, most likely you're going to develop some symptoms.